Welcome back to the Deep Dive. This is where we try to make sense of all that information you send our way, boiling it down to what really matters.
And today we're tackling a huge one: youth mental health, suicide risk, and screens. Plus, the places kids grow up.
Yeah, it's probably the topic we get the most sources on, often with headlines that, frankly, can cause a bit of panic about screen time.
For sure, it feels overwhelming, right? But the data often lacks precision. So today, we're focusing on two really powerful studies to cut through some of that noise.
Okay, so what do we got? First up.
First, a big longitudinal study. It's part of the ABCD study that's Adolescent Brain Cognitive Development. They followed thousands of kids for 4 years.
And this one helps us separate kind of the hype from the actual risk when it comes to digital devices.
Exactly. It gets specific about how kids use screens, not just how long.
Okay, and the second source.
Second, we zoom way out. A huge analysis looking at entire U.S. counties. And instead of just one thing, like poverty, it used machine learning to find these complex clusters of factors: social determinants of health, SDOH, and how those specific community types link to suicide rates.
Got it. So our mission here for you listening is really to get past the easy answers, like forget just counting screen hours or blaming only poverty.
Yeah, we're looking for the patterns, the trajectories, the specific combinations of factors that actually drive risk, things that could actually change how we intervene.
Okay, let's dive in. Where do we start?
Let's start with screen time, because the first big finding really flips a common script.
All right. That first study, the ABCD one, we hear constantly, too much screen time is bad. But this study followed, what, over 4,000 kids from age 10 to 14?
That's right, 4,285 kids. And
Now,
they looked at total screen time at the beginning.
what do they find 4 years later about things like suicidal thoughts or behaviors?
Well, here's the bombshell. Total screen time at age 10 was not linked to suicidal behaviors, ideation, or worse mental health outcomes at age 14.
Wow. Okay. So all those headlines, the panic about hitting a 2-hour limit or whatever, this study says that number, the total time, isn't the predictor.
Precisely. It basically says the clock itself isn't the danger signal we thought it was for these serious outcomes down the line.
That's huge. It really shifts the focus. So if it's not the total time, what did this study flag as being important?
It zeroed in on what they called addictive use. It wasn't just about hours logged.
Okay, addictive use. What does that actually mean here?
They measured things like compulsive use, feeling unable to cut down, difficulty disengaging, getting upset if you have to stop, and feeling distressed when you can't use the screen.
Right, so that feeling of compulsion,
Yeah.
of it controlling you rather than just using it a lot.
Exactly. They assessed this pattern for social media, mobile phones in general, and video games. And that pattern of use, that addictive quality, that's what turned out to be linked to risk.
It gets even more specific, right? Because they didn't just measure it once. They looked at how this addictive use changed over the 4 years, the trajectory.
Yes, the trajectory, that's key. Between ages 11 and 15, roughly, they didn't just see high or low use, they saw pathways.
Okay, let's break that down. What pathways did they find for, say, social media?
For social media and also for mobile phones, they found three main trajectories. There was a low group,
Yep.
a high or high peaking group, kids who were consistently high or peaked high,
Right.
and then crucially, an increasing trajectory group.
Increasing, meaning kids who started lower but ramped up their addictive use significantly over those years.
Exactly. Kids who started maybe moderate around age 11 but showed high levels of addictive use by age 14. And this group was pretty big.
How big?
For social media, almost a third of the kids, 31.3%, were in this increasing addictive use group.
Wow. Okay, and the risk associated with that specific trajectory compared to the low-use kid?
It was significant. For suicidal behaviors, the risk ratio, or RR, was 2.14.
2.14. So more than double the risk.
Yeah, 114% higher risk of suicidal behaviors compared to the low-use group. And for suicidal ideation, thinking about it, the RR was 1.46, still substantially higher.
So that pattern of escalating compulsive use during those early teen years is a major red flag for social media.
A major red flag, much more so than just knowing how many hours they spent online overall at the start.
Do they see similar things for the other groups, the high-peaking social media users or mobile phones?
Yes. The high-peaking social media group actually had an even higher RR for suicidal behaviors, 2.39, so really high risk there too.
Okay.
And for general mobile phone addictive use, the high trajectory group had an RR of 2.17 for suicidal behaviors. So, similar ballpark.
What about video games? Often lumped in with social media, but was the pattern the same?
A bit different for video games. They only really found two clear trajectories, high addictive use and low. And the high group was surprisingly large, over 40% of the kids.
40%. Okay. And the risk link there.
It was linked to higher suicidal outcomes, RR, around 1.5 for both behaviors and ideation, so still a risk. But the really standout finding for video games was something else.
What was that?
It was the connection to internalizing symptoms.
Meaning things like anxiety, depression.
Exactly. Sadness, withdrawal. Across all the screen types they looked at, the high addictive video game trajectory showed the biggest difference in these internalizing symptoms compared to the low use group.
How big a difference? You mentioned a T-score.
Yeah, they used T-scores, which are standardized. A score of 50 is average. The difference between the high and low addictive video game groups was 2.03 points on that scale.
Okay, so for listeners, what does a 2.03 T-score difference mean practically? Is that significant?
It's definitely significant in clinical terms. It tells us those kids in the high addictive use group are reporting noticeably more anxiety and depression symptoms than their peers, enough to be concerning.
So maybe less tied to immediate suicidal action compared to escalating social media addiction, but strongly linked to feeling worse day to day.
Yeah.
More anxious, more depressed.
That seems to be the pattern, yes. A strong link to that internal struggle.
Fascinating.
Yeah.
So if we boil down this first part, forget the stopwatch, monitor the behavior. Is the use compulsive? Is it escalating, especially between 10 and 15? That's a much better sign of potential trouble than just the total hours.
Absolutely. It suggests interventions should focus on identifying and addressing that compulsive pattern, not just setting time limits.
Okay, huge takeaway there. Now, let's shift gears. We've talked about the individual and their screen. Let's zoom out to the world they live in.
Right. The community environment. Social Determinants of Health, or SDOH.
This second study is pretty different. It used machine learning across thousands of U.S. counties.
Yeah, over 3,000 counties, looking at data from 2009 to 2019. And they threw in hundreds, 284 different characteristics for each county.
Wow. So not just poverty rate or unemployment.
No, way beyond that. Things like housing, access to healthcare, demographics, family structures, even environmental factors like air quality or heat exposure. The idea was that these things don't exist in isolation.
They cluster together.
Exactly. The machine learning helped identify the natural ways these factors group together, creating distinct types of county environments, much richer than just a single score.
Okay. And how many types or clusters did they find?
They landed on three main ones. They called them remote, cope, and diverse.
Remote, cope, and diverse. Let's take them one by one. What defines remote?
Remote was actually the most common type, making up around 60% of U.S. counties. Think classic rural America.
Okay.
Characterized by, well, being rural, having older populations, often more marginalized elderly folks, older housing. Isolation is a key feature, geographically and maybe socially.
Got it. Rural, older, potentially isolated. What about cope? Sounds intense.
It represents areas under significant stress. The name isn't an acronym, but it captures the vibe. These counties have high poverty, complex family situations, often poor health insurance coverage, but high use of emergency services.
Like they're struggling to cope with basic needs.
Pretty much. And interestingly, high exposure to extreme heat was also part of this cluster's profile. It's a picture of chronic economic and health system strain.
Okay. And the third one, diverse. Sounds like cities.
Yep. Diverse captures the dense urban centers, high population density, lots of immigrants, but also big economic inequality. Think poor air quality, and critically, really expensive housing, high rents.
So the pressures of dense, unequal city life.
That's the essence of the diverse cluster.
All right, so we have these three distinct place types: remote, cope, and diverse. Now the crucial part, how did suicide rates differ across them? And for whom?
This is where it's really striking, and the demographic differences are key.
Which cluster had the highest overall rates and saw the biggest increase over that decade?
That was the remote cluster. These largely rural, predominantly non-Hispanic white counties had higher overall suicide rates, especially for men.
And those rates went up the most steeply between 2009 and 2019.
Yes. The steepest rise was seen in these remote counties. It suggests that whatever factors were driving risk there, maybe isolation, lack of services, economic changes, they got significantly worse over that decade for that population.
Okay. What about cope, the high poverty, high stress counties?
In the cope cluster, the elevated suicide rates were particularly noticeable among white individuals.
So in those areas defined by economic hardship and maybe poor healthcare access, white residents seem particularly vulnerable.
That's what the data suggests, yeah. Highlighting the toll of that specific kind of chronic stress.
And then diverse, the urban, unequal, high-cost areas, a totally different pattern.
Completely different. In the diverse cluster, the increased suicide rates were seen among women and specifically among Black and Hispanic populations.
So the pressures in those environments seem to impact different groups.
Exactly. And here's a critical link back to our earlier discussion. The diverse cluster also saw significant increases in suicide rates among young people aged 15 to 24, and among non-Hispanic Black populations specifically, over that same 2009-2019 period.
Wow. So the environment matters immensely, but how it matters depends on who you are and where you are.
Precisely. The factors driving risk for, say, an older white man in a remote rural county seem very different from those affecting a young Black or Hispanic person in a diverse city facing inequality in housing costs.
Which means a one-size-fits-all approach to suicide prevention probably won't work very well.
It absolutely won't. That's the major policy implication here. You need strategies tailored to the specific SDOH profile of a place remote, cope, or diverse, and tailored to the demographic groups most at risk within that environment. You can't just have a single national campaign and expect it to hit the mark everywhere.
Okay, this has been incredibly insightful. We've gone from the individual kid's screen use pattern, all the way out to the macro, the type of county they live in.
And the two big takeaways seem to be, look at addictive use patterns over time, not just screen hours.
Right.
And look at the whole cluster of social determinants in a community, not just single factors like poverty.
Which brings us to a final thought, connecting these two threads.
Yeah, I mean, if we know certain groups like Black and Hispanic youth are often concentrated in these diverse urban areas facing specific stressors like inequality and high housing costs.
And we also know from the other study that the increasing trajectory of addictive screen use, especially social media, is a potent risk factor for that same age group.
Then the really challenging but crucial question is, how do we design interventions that tackle both things at once? How do we address the environmental stressors and the patterns of digital use that might be amplifying the distress, especially for these vulnerable young people in those specific environments?
Addressing that intersection of place-based stress and digital behavior patterns.
That seems like where the real work needs to happen next for effective prevention. We need to get specific about those combined risks.
A really powerful point to end on. Understanding these complex patterns is key. Thank you so much for walking us through this.
My pleasure. It's vital stuff.
And thank you, as always, for joining us for the deep dive. Keep digging into these important connections. We'll talk to you next time.
This was the Gist Podcast. If you liked it, please leave a like and subscribe to this channel.